Hi, everyone. Welcome. Really pleased everyone's here today. And in lieu of having our discovery in person, as you know, those of you, you've all registered, we're going to do discovery online. This is our first webinar in our discovery series. We expect to have them at least every 6 weeks, sometimes possibly more frequently. I'm Janine Robinson. I'm your moderator today and your co-host with Dr. Sasha Stark. Sasha?
Hello, everyone. Dr. Sasha Stark, Senior Researcher.
I'm the director for the Center for the Advancement of Best Practices and the managing director of RG+. And with my team, we've brought together today some evidence from around the globe to share with you around some of what we can forecast around online gambling risks and strategies in these unprecedented times. This webinar will be about 45 minutes in total. We're going to stop for moments and ask, giving you an opportunity to submit your questions, and we'll respond to those. Those will go into a chat box, and they'll be forwarded to us. So you will, in a Q&A box, not the chat box. So in the Q&A box, put in your questions, and they'll be forwarded to us, and we'll pause at different points to respond to those. We have over 300 people registered for this webinar, so it is a small world, getting smaller in the time of COVID. I just want to let you know where people are from. So we have treatment, we have research, we have regulators, we have operators, we have public health specialists. We also have representation from 24 countries at this particular event, and I'm going to read them very quickly. Angola, Austria, Australia, Islands, Bulgaria, Canada, Cyprus, Denmark, Spain, France, Greece, Hong Kong, Japan, Cayman Islands, Macau, Netherlands, New Zealand, Portugal, Sweden, Singapore, Thailand, Turkey, United Kingdom, and the United States. So welcome, everyone. After this session, we will send out the recorded version of it for your files, so you can reference back to it, and we're always available to chat after. So welcome. This is what we're going to talk about today, as you know, because you signed up. We're going to look at how this pandemic is impacting online behavior and what are the risk factors that might be accelerated based on people being in lockdown, as well as the financial and other uncertainties the world is facing. And who are we, RGC? Just in a nutshell, most of you know that our home base is in Toronto, and that we do work at various countries around the world. We're an independent nonprofit organization, and we work with all sides who have vested interest in looking at reducing gambling harms. So we work with the general public, we work with operators, we work with treatment professionals, policymakers. Our team has been involved for 35 years in research related to prevention and education. And that's a nice segue to introduce Dr. Sasha Stark, who's going to sort of look at some of the foundational pieces of information informing our approach to risk.
All right, hello, everyone. So restrictions would impact online play, considering the closures of land-based casinos and other gambling opportunities, as well as the stoppage of sports. But are we seeing it? So in the next couple of slides, we're going to look at some of the results from around the world. But first, we'd like to put an audience poll to you. So what types of gambling have you seen increase since the beginning of the pandemic? So we have esports, virtual sports, online casino, online poker, or haven't seen an increase. So make your selections. 7 seconds. We'll get to see what you're seeing around the world. All right, so hopefully everyone has their answers in. We'll see how your answers compare to what we've seen elsewhere. So we're seeing esports, we have 11%, virtual sports, 11 as well, online casino, half of you are seeing increases in that, that's quite high. 30 for online poker, and 30 are not seeing an increase. Very interesting. All right, so we'll see how that compares to some of the results that we're seeing from around the world. So globally, we're seeing overall, not surprising, that there's been a decrease in spending on gambling, considering the amount of opportunities that are now closed. However, we're also seeing that almost a third of people are looking for new types of betting. And considering all the closures, new generally means online. So some Canadian research based in Ontario, conducted by us here at the RGC of over 2,000 people, we found that of gamblers in the province, over half of them have gambled online in the last 6 weeks, or the last 6 weeks since the emergency measures had been implemented. That roughly a third of these people who have increased their gambling are saying that it's due to social distancing measures. And almost a quarter have gambled under the influence during this time. Moving now to the UK. The Gambling Commission reported recently that 64% of the most engaged gamblers are increasing the amount of time and money that they are spending while gambling. And they've also reported that there's been an increase in the number of sessions that are lasting over an hour, even though the overall session length has decreased. Very interesting stat here, 41% of people, of those who are betting online since the pandemic, have opened a new betting account. So what we're seeing is that a large number of players are starting to gamble online perhaps for the first time, or playing with new operators or new games. And the question here would be, is this increase, are these changes overwhelming current RG resources? Moving now to the US, there's a similar increase in new player signups in New Jersey. And we're also seeing a very large increase in the amount of spending on online gambling in certain jurisdictions like Pennsylvania. Moving now to Australia. Online gambling spending in the week of April 27th to May 3rd was up 142% compared to a normal week before the pandemic. So this compares, or is overshadowed only by food delivery, which is likely for things like toilet paper and possibly wine. So as your poll responses show, there are increases in a lot of jurisdictions and a lot of game types. However, not all game types and jurisdictions are seeing increases. So we're seeing changes in terms of the types of things people want to play, as well as increases in the amount of gambling and players moving to online. And what this is showing is that the player has changed, and so the risks have also changed as well. So it's likely that we need to bolster our resources around responsible gambling during this time. We're just going to go back one slide and quickly review the types of gambling that are changing. So we're seeing both an increase in, or a resurgence in games that were previously popular, so things like casino games and poker, as well as the emergence of new favorite games by players. So I'm sure many of you have seen these in your own experience as well as in news, but there's been an increase in gambling on things like ping pong, sumo wrestling, home darts tournaments, things like that, so these obscure sports. There's also a large increase in esports. So one esports betting tip page reported over a 900% increase in people coming to the page to look for tips. We're also seeing a large increase for virtual sports. So one operator reported a 300% increase in gaming revenue for this line of business. Interestingly, there's also betting on various non-gambling specific events like television and politics, as well as COVID-specific outcomes like the development of a vaccine and the lifting of lockdowns. So the key theme with these changes, especially in game type, is that there might be a heightened risk for many of these with the speed of play, as well as heightened risk from changes in the motivations for people of playing. And with so many new games and new players, there's potentially a large level of limited informed decision making. So the key here is to build RG needs that best address these needs in the current situation. So we have a pause here for questions. So I'll give everyone a couple of seconds to think through the intro of our webinar and see if there's any questions that come up so far. And if we don't have any, that's completely fine. We have a couple more opportunities to pause as well. All right, so I think we'll move on from here.
Yeah, I'm seeing nothing from Melina. So we can think of a variety of ways that COVID could be impacting the risk factors related to gambling harms. But so what does this look like in real life? The COVID-19 risk factors, you all know: recession, job loss, financial uncertainty. All of these, of course, associated with issues related to gambling. Isolation and loneliness, stress and mental health. This is an unprecedented time, and all of these risk factors are happening together on a global scale. So the impacts will be unprecedented as well, and it's important for us to really think through in new ways how to monitor the risks, look at outcomes, and be adaptable to meet player and business needs. One of the things that's of great concern, and I know that the treatment people on this webinar will be attuned to this issue, is the use of substances while gambling. And we, in the survey that Dr. Stark cited earlier that we've just completed in Ontario, on people who are online gambling are seeing the increase in substance use by 40%. And that little, and the Canadian maple leaf, for those of you who don't know, is actually a cannabis leaf, and it's the increase in cannabis is legalized in Canada. For those of you who don't know, cannabis use, 48.7% increase in that. So thinking about sort of the attendant potential for harms, it increases. So when we look in practice, like what kind of players might be playing? What would be a player profile, a new player profile, perhaps? Sasha already described the new games that are happening, but in practice, there might be a lot of people who are, and we know this to be true in Ontario, people who are going online who formerly weren't online. And so this, raises the possibility of having new players who are isolated, who are dealing with stress, who are in potentially unfamiliar financial terrain, going online and having possibly a small win that might lead to them having a false idea of how likely it is to happen again, but also thinking about the comorbid uses of substances. So there's lots and lots of scenarios, as you all know, because we're all dealing with this pandemic together. Some of us are alone, some of us are in stressful situations, some of us have family members who are unwell and we can't see them. There's a lot of stress at this time. All of these factors contribute to the heightened risk. So what am I saying here? I'm saying that there are foreseeable issues that are going to arise and that we need to be proactive. So looking, what are some of the safeguards that operators can implement to minimize the risk? And not just risk to players per se, but also risk to the industry, right? If your player base is not sustainable, the industry is not sustainable. So how do we minimize risk? So looking, we're gonna take another audience poll here and get your opinion. What safeguards do you think industry can implement right away? Play behavior safeguards, information, informed decision-making information, Sasha was talking about, knowing your players, game design, and anyone who contributes other. I'd love for you to put a Q&A question related to that. I'm just curious what people would say about that. So the number of people who answered player behavior safeguards is 58%, 56%, sorry. Information for players, 28. Know your players, 5. Game design, 10. And other 2. So safeguards and information, really clear. So we're on track here with what we're going to talk about next, because we're looking at different safeguards and then different pieces of information. We haven't built that out in great detail in this particular webinar, but we're happy to talk with anyone afterward who really wants to unpack what type of messaging might be most successful in this time. And a little bit of what we're going to have to do here is be creative. These are unprecedented times, and it's an opportunity, paradoxically, for us to be innovative. Hospitality industries, essential businesses, essential services are all doing new things. I know I'm not the only person who's going through my day in a new way, and I'm often surprised, especially in the hospitality sector, at how creative restaurants, other industries have been at getting their product to market. So we have an opportunity here also to be innovative. And we need to prepare the gambling industry and people who gamble for their very worst day. So what I mean by that is when we're thinking about regulations, we're thinking about safeguards, that at the best of times, those are nice to have. at the hardest of times, they're necessary to have. So the baseline safeguards that we put in place now actually will protect players on their worst possible days and industry in its worst possible day. And to me, that's what a robust safeguard system would include. So we also have an customer service, identify new approaches for sustainable play. Some of these solutions may be in-game solutions around things like looking at mechanisms of not allowing withdrawal reversals, for example. But some of them might be out-of-game solutions around how we communicate, how we advertise. And some of them may be just more broader around strengthening links to treatment, for example, or trying out something altogether new about incentivizing responsible gambling. Get rewarded in some way? Do they get do they get the same type of incentive for using the safe play tools that you have? These are things we can be thinking about very creatively. Now's the time. Sasha?
Excellent. So to get a little bit more specific in some areas where the industry can be innovating, we'll start by talking about player monitoring. So I'd like to flag that some of the things we'll be talking about in the coming sections are not new and they already exist. But in these circumstances, it's possible to augment, to tailor, to innovate around these tools or with these resources in the current situation. So the main message here is to use all of the resources, all of the data that you have available to support your players and to improve your RG. So for player monitoring, we can begin by engaging stricter monitoring and boosting customer contact with the thresholds that are already being used. And we can also re-examine the markers of risk that are currently being used. So this can include things like examining whether the thresholds that are currently being used are appropriate, especially around things like affordability. And it can also be looking at and thinking about whether the typical player has changed in the current circumstances and how that would impact markers. And so both of these questions can also lead to adding new markers as well. And next, for player communications, as I discussed above, there's a lot of new players, there's new games. So for new players, it's very important to have thorough onboarding and appropriate informed decision-making materials. So people are experimenting with new forms, they're playing new games, they might be gambling for the first time. So it's important for this information to be highly visible, heavily promoted, as well as easily accessible and easy to understand. For existing players, it's possible to do pre and post COVID messaging reports and messaging to see how behaviors have changed before and after, and perhaps flagging people to considerations or behaviors that may have changed and how their situation may have changed over this time. So this can be valuable for all players as well, to reinforce messaging around the pandemic about not gambling to escape, considering financial situations, as well as Janine was mentioning, messaging can be focused around this incentivizing piece by perhaps moving some of the messaging towards this incentivized RG and away from certain messaging focused on having players play more. So the next area of recommendation is around marketing and advertising. So this applies both to online as well as TV and radio ads, considering the amount of time people are spending online and our focus here on online gambling. So as Janine mentioned, the focus on innovation is we're seeing around the world, but so is the focus on limiting harm. So that's something that we want to be doing in the gambling area as well, and is important for looking at specifically around messaging. So this can include things like operators, some operators are already doing this, some regulators are already asking for this, to ensure that messaging doesn't imply that gambling can relieve negative impacts of COVID restrictions. Considering stepping up RG messaging overall, as well as within the specific ads that are being put out. And finally, considering replacing marketing for new players with RG messages. So cautionary tale here is that we're seeing in the UK, operators are coming under scrutiny for some of the messaging that's RG focused that they're putting out, since it's branded. So it is possible to promote RG on its own, and one workaround may be to consider limiting broad-based messages at this time and focusing on messaging that's within the platform directed specifically at players around responsible gambling. So we're actually going to explore the UK as a case study a little bit more here. So we're seeing around the world that discussions around player safeguards are occurring. And one place where a lot of this is happening publicly is in the UK. So we're seeing here that many stakeholders are involved in the conversation and that different safeguards are being both implemented and recommended. So if we can go back a slide quickly. So the UK Gambling Commission has updated their guidance, I think it was just yesterday, to provide additional recommendations for operators in the current situation. So some of these include not offering bonuses or promotions to customers showing indicators of harm, interacting with customers who've been playing for more than an hour in a single session, considering the finding I reported at the beginning. And also, as we've been discussing, reviewing thresholds and triggers for new customers, especially considering a lack of knowledge of people's play patterns and their history. Also included in this discussion, the Betting and Gaming Council, which represents 90% of the operators, has introduced a 10-point plan of their own. They've also added a couple of things, including a 25+ age filtering for ads, as well as removing or changing TV radio ads. So either removing them altogether or making them responsible gambling focused. And we're also seeing a reporting tool available for the Advertising Standards Authority. So an additional piece in the UK is there's a lot of media around the various safeguards that can or are being implemented. So there's calls for very strict RG measures. There's reports from people that online gambling advertising is increasing at large or at quick pace, and also that RG marketing is really just looking like advertising. So the main message with this case study here is that stakeholders need to work together and keep reviewing and updating procedures for the safety of players. It also shows that finding the sweet spot for responsible gambling can be quite difficult, and that there's a lot of things to consider, including what type of players are playing, the range of players, and considerations for pushing people to or from certain types of gambling and certain sites. So we're going to pause here again for questions. So I've seen some come in, so feel free to type some questions as well, and I'll have a quick look here to see some of the ones that we've gotten so far.
I saw one that was asking why we would recommend not focusing on the social distancing aspect, and I'm just going to contribute to the answer to that. I think people know about the internet and are using it already to cope with isolation. We're ordering our groceries online. We're doing almost everything on it. I'm in my living room right now, using my internet and my iPad and my laptop. So I don't think that's new news. But what is different about gambling, and this ties into the slide around the increased substance use that we're seeing in Ontario, is the risk associated with the behavior that is different than the risk associated with other online behaviors. So I think that's one of the reasons not to. It's foreseeable that people will make choices that are not their best choices at this time. I know I've made a few myself, not so much around gambling, but possibly food or wine. So thinking about what's foreseeable and predictable around this, and given the information we have around substance use, that would be my answer to that question. Dr. Stark, did you want to take any of those questions?
Yes, so I'm seeing a couple that are addressing a similar theme in that, is there any evidence of impact of the risk factors or impact on harm? So the answer is yes and no. So we're very early, I would say, in terms of research in the process of seeing the impacts of these things, as well as gathering the data. I know that there has a study just been launched in the UK that is looking at changes in various behaviors, including gambling, specifically related to COVID. And what we're seeing in the survey that we conducted in April is that we are seeing for sure impact in the actual risk factors. So there is an increase in the number of people who are experiencing job loss and things like that. And we are also seeing some of those impacts over the 6-week period. So some people are saying that or some of the people who are gambling more have experienced an economic situation where they've lost their job or decreased work hours. So some of that is starting to bear out, but it's a little bit early to say for sure in a lot of cases.
Great. Good. Thank you. I saw another a slightly cheeky question about would we also recommend limiting online shopping. It's not my area of expertise. Sorry. I'd like to answer. Um, Thank you for the question. Moving forward, what are some things the industry might consider? Now, again, we're talking about being innovative here. So some of the things we might consider might be things that we haven't tried, might be something new. I'm going to start with an audience poll though and see what you think. What do you think? And we've given you 4 options, but option 5 is the other around the most important needs. For evidence for the industry of what we can do that would be working. Because some of this, as I said, we don't know. So make your selection. All right, and okay, most important needs for evidence. 44 answered to A, increasing effect is 20 to B, 35 to C, 39 to D, and 1. So the A, C, and D, the increasing the messaging effectiveness, influence of social media on gambling, and the impact of player incentives. Everyone wants evidence related to that. So for all the academics here and all the people involved in collaborations with industry on research, these are some things we could be testing. I'm going to encourage us to think about new messages and creative, not yet tried strategies, as well as what we know has worked in the past. So leading with purpose is just a broader way to describe what we're encouraging industry to do here. Now's the time to make responsible gambling a more robust, centralized part of communications. And part of the why, like what's in it for me kind of answer to this, is to avoid the potential for a tsunami of self-exclusion or burnt out players who, if they play beyond their limits at this point in time, all those new players who are going online that we've seen, if they are playing beyond their limits or experience unintended consequences early on in their customer journey, that's going to be bad for them and bad for business. And we can also be looking at proactive ways to identify new outreach strategies for your customers and looking at how we adapt our tools as we go forward. We also want to make sure that when we're looking at this, that we ensure that we've think about any unintended consequences of the strategies that we take. We have new players, we have a new normal, and I'm wondering if it's also time to think about new RG training. And one of the most important parts of that for me is thinking about the ethos of responsible gambling being an upstream approach. Responsible gambling at the heart is a prevention and health promotion approach that is for all players. And in a lot of jurisdictions still, I think responsible gambling is still seen as a response to problem gambling. And that's part of it, of course. But training also has to really focus on the broadest part of the customer base to help inform them, help them make decisions, help them understand what the risks are, how to play safely at all points of their customer journey. So we can move beyond sort of compliance training and look at higher level training that is segmented. Do we have training right now for customer service reps who might be interacting with customers around different types of issues than they have in the past? Or there may be emerging issues. And have we been nimble in responding to those needs for customer service people, for example? Have we been nimble to responding to the needs of marketing? How do you market your offering and promote responsible gambling with the sort of weight that we are proposing? And using ongoing reinforcement so that training isn't seen as a discrete event, but as an ongoing part of how you equip staff, how we equip staff to interact with customers. And that can be all the way from C-suite training to frontline training. So thinking about standards, looking at if you want to think through those in your jurisdictions, if you want to take a look at your online offerings and you want to sort of look at some standards and criteria that you can measure your programming against, you can go to this link here on the RG Check Accreditation for iGaming page. It will give you it'll give you a bit of a taste for the types of guidelines that could help operators figure out what next steps are most appropriate for you. This is an evidence-based accreditation program that can inform changes to keep you up to date. So feel free to visit that website and see if there's areas that resonate for you in your jurisdiction around areas where you could complement your existing program. Looking at RG programs more broadly across the player journey. When I was saying earlier that responsible gambling as an ethos should be housed for all players across all the player spectrum, the staff training, awareness and education, accreditation, those types of programs are appropriate for everyone in the general population. And that should be where a great amount of emphasis is placed in preventing harms in the first instance. There are specific programs that can be implemented for at-risk and high-risk populations, and they need to be targeted appropriately. You don't want to have a general population program that says nowhere to call counseling if you don't need counseling. If what you need to understand is how to use the RG tools and how to bet safely, or how to set a limit on your gambling, this is the general population type messaging. So thinking about how we structure our programming, the broadest base programming, the widest reach should be for prevention writ large, and then moving down to more specific training. For example, for at-risk players, there are markers that we can identify that show that someone is at risk. We can increase our emphasis on pre-commitment or tailored messaging for those groups. And then for the very smallest end of the player spectrum, people who are experiencing the highest harms, those are the people to whom we really need to think about our self-exclusion programs and our information that we provide them, and that would be referral information, how to access treatment or how to access credit counseling. So we're going to close up in a sec. I'm going to sort of leave one thought for each area who's represented here. As I said at the beginning, there's treatment on the line, there's academics, there's operators and regulators. So treatment, one of the things thinking about now is at this particular time that is unique is that you kind of need to think about, you might have a paradoxical patient situation happening. And by that, I mean that people who have ostensibly the highest social supports might be the people who are at highest risk at this time. So thinking about young men, affluent, educated, good social supports. Those might be the group of people who you don't typically see in a tertiary care treatment setting, who really need some harm reduction strategies and messages. Operators, thinking about RG upstream and incentivizing players and staff to use RG messaging. So incentivizing staff to promote responsible gambling. There's many ways to do that. It could be financial, it could be embedded in the performance reviews, it could be via training, and incentivizing players. It could be having some sort of bonus structure. It could be having something that they can use that isn't related to gambling at all, that incentivizes them to use RG strategies. Regulators, thinking about the carrot and the stick, some of the carrot opportunities might be if you're in a situation where you can fund to encourage or require cross-sectoral collaborations in the research. So to have teams who can do applied research, teams who can have public health outcomes as part of the work that they do, and teams that can work collaboratively with industry around using the data to truly understand what's happening with players. Could also think about things outside of gambling altogether, like promoting community-based activities that have nothing to do with gambling, or looking at working with the financial sector around protecting family members of people who gambled. Lots of areas there for the sort of carrot approach. Research. One of the things that comes to me often is that our teams often are not interdisciplinary when we do research. Sometimes they are, but really thinking about the benefits of having interdisciplinary teams so that we can really accurately understand the data that we're reviewing and really apply it well to have a public health impact. Those are sort of the takeaways. I'm going to ask you, we're going to go to a poll here and think your thoughts on what you think are the biggest opportunities for innovation in responsible gambling. So here they are, 15 seconds, advancing player monitoring, incentivizing RG, building RG into new products from the bottom up, revitalizing training, or something altogether other. And the answers are advancements in player monitoring, 31%, 48% for number 2, incentivizing, 44 for number 3, and 28 for number 4, thank you, and 1 for number E. The incentivizing RG behaviors, we've been talking about this in the field for a while, and there's not very many operators or jurisdictions who I've seen doing it in a way that they've at least showcased publicly. So I'd really love, we have a few minutes here before this webinar wraps up to talk through what some of those incentives might be. And the chat box, Melina, is there anything in the chat box that we should respond to or any questions?
So I saw one question earlier about why limit relief of impact of social distancing? Isn't that one of the provable benefits of gaming social interaction? So I think when we're saying to not suggest that gambling release the impact of social distancing, it's not all of the impacts, it's specific ones. So gambling to escape, obviously we don't want to encourage that. So it's not the social impact that we want to deter from. It's the more the impacts of social distancing that are also risk factors that should be avoided in the messaging.
Right. How do you view the potential for added stigma by placing too much emphasis on treatment too early in the player journey? I am really grateful for that question. Treatment should not be emphasized at the beginning stages of the player journey. So we talked earlier in the webinar around increasing customer service. RG should be embedded at all points of contact with all customers throughout the customer journey. So if someone does begin to develop some sort of high-risk behaviors, that your algorithms are on fire, you're seeing that they're having that they're someone who's predicted to self-exclude. Those are players for whom you provide a treatment message. If I'm a recreational drinker and you tell me I could get cirrhosis of the liver, if I get cirrhosis of the liver, I can, I'm going to have a liver transplant. You've given me you've given me a late stage piece of information about an early stage behavior. What I need to know is what the safe drinking guidelines are. Similarly with gambling, players at the early stage of the process really need to understand the risks. This is a product with risk, that's why it's age restricted, what the risks are, and how to make decisions for themselves based on their own life. That's the type of information. So it needs to be, that's a broad-based at the top of the triangle kind of information I was talking about earlier.
I saw another question. I sometimes feel that concern for unintended consequences is a barrier to innovation. Do you have recommendations for how operators can approach that balance? I think the key here is both planning and evaluation. So being thorough in considering the possible consequences that could occur and having a thorough and quick evaluation. So if data is being collected on the impacts quickly and being reviewed often, you'll increase your chance of finding those unintended consequences and addressing them. So if you develop that plan, it's likely to increase comfort in trying something new. So if you feel like the product you developed as well as the plan to evaluate is solid, you'll feel more confident in trying something.
And I think also that speaks to our call to have interdisciplinary teams working on these problems, because a clinical psychologist versus someone with a degree in public health versus someone with a degree in sociology will have different lenses to the issues, as will an operator, as will someone who gambles, as will a family member of someone who gambles on that exact product. So you can take one situation and you could have 7, 10, 100 different perspectives on that one change. Right. So if you have an interdisciplinary team that sort of has their finger on the pulse of those potentials, you can actually decrease the likelihood of designing something that backfires in the long run. So players are part of that, but also broadening beyond traditional research teams in some cases. I'm reading questions. Sasha, do you have one you're ready to respond
Sure.
to?
So there's a treatment one that perhaps you can address there, Janine, but there's also a question about how is an operator able to incentivize RG behaviors if it can't be a bonus? So some of the examples that have been discussed for land-based gambling offerings is similar incentives to other programs. So it can be a drink voucher, it can be things like that that are not necessarily gambling specific. They're within your offering, but not necessarily focused on gambling behavior specifically.
Thank you. The question you were referring to is, what can clinicians do to introduce harm reduction or RG messaging to their clients? They're not seeing an increase in referrals into treatment, unsurprisingly, especially when you think about the paradoxical patient I was describing earlier. So a couple thoughts come to mind. One is shifting some of our orientation to how counseling is provided, and we might be thinking about providing those services in conjunction with other services. So I know in some jurisdictions there's a nice tie to credit counseling, for example, or housing services or social assistance services. There might be a way to bundle some of that programming together. And another one is thinking about treatment doesn't really do a lot of outreach to gambling in most jurisdictions, and some they do. In Australia, they do a fair amount, but in a lot of jurisdictions, they don't. And so one of the messages is you don't have to have a gambling problem to have problems from gambling, right? So you don't have to be in a life or death situation in order to benefit from what counselors can offer you. So if you have a harm reduction message that helps people understand that they can access your services without having to quit gambling, admit they've done something that they are ashamed of, or make a decision that they are beyond all help and you're the last stop on the road, then that's likely to increase the sort of earlier presentation of clients. But that's a bit of a road to hoe for us, admittedly. There's still a lot of stigma around receiving help because people think it's like problem gambler.
Another question from earlier was, is RG Online realistically possible since players can sign up to new sites quickly and there's no interaction between them? How do we measure success since a player's data may look low risk because they spread it around multiple sites? So I think this question addresses bang on our call for innovation. So we know that there's a lot of operators in various jurisdictions that are looking at ways to build this kind of full player view. So this is a perfect time to look at doing that type of work and seeing how it can benefit the player and the operator, especially around responsible gambling.
Great, thank you. And I think that brings us pretty much to our time. I want to let people know that we will be sending out an evaluation and we'll be sending out a link to this webinar. Mike, if you could advance, please. And we'd like you to share your thoughts with us. We'd also like to know from you what other topics you would like to have. We have a roster of topics that we weren't able to present at Discovery that we already have on board, and we're happy to take new ideas. Our next webinar is May 28th, and you can sign up on our website. And we're going to be looking for land-based gaming at what operators, as well as like PlaySmart, PlayWise, GameSense, people need to think about around what might be some of the differences, some of the new normal when people return to land-based gambling. So please sign up on responsible gambling on our website to hear more about our webinars. And again, I would really like to thank all of you for joining us for our first in the Discovery series. And it's been a pleasure. You can contact Sasha or I directly, or you can just contact RGC on our website more broadly as you wish. So I wish you all the best. I wish all of you safety and well-being, and take good care. And we'll see you.